Up to this point, we have examined beneficence as a guiding moral obligation in healthcare, sometimes exercised paternalistically, and sometimes exercised through respectful, shared decision making. However, modern medical ethics rarely treats beneficence as a standalone principle. Instead, beneficence is most often understood within a broader ethical framework known as principlism. In this lecture, we will explore what principlism is, why it has become so influential in contemporary healthcare ethics, and how beneficence functions alongside other ethical principles in real clinical decision making. What is principlism? Principlism is an approach to biomedical ethics that emphasizes the use of multiple moral principles rather than a single overarching theory to guide ethical decision making in healthcare. Rather than asking, what is the one correct ethical rule? Principlism asks, how do we responsibly balance several important moral commitments in this situation? In this framework, beneficence is considered alongside other core principles, most notably respect for autonomy, nonmaleficence, justice. The central claim of principlism is that ethical healthcare decisions require careful balancing, not rigid rule following. The four core principles. Although different formulations exist, principlism is most commonly associated with four foundational principles: beneficence, the obligation to act in the patient's best interests and promote well being; non-maleficence, the duty to avoid causing harm; respect for autonomy, the obligation to respect the patient's right to make informed, voluntary decisions; justice, the requirement to ensure fairness, equity, and appropriate distribution of healthcare resources. No single principle automatically overrides the others. Ethical judgment involves weighing them in context. Beneficence within a principlist framework. Within principlism, beneficence is not absolute. It is a strong moral obligation, but it operates under constraints imposed by the other principles. This means that acting in what appears to be a patient's medical best interest may still be ethically impermissible if it violates a competent patient's autonomy, causes disproportionate harm, creates unjust disparities in access or resource allocation. Beneficence must therefore be interpreted relationally and situationally, not in isolation. Why principlism emerged in modern medical ethics? Principlism emerged in response to the increasing complexity of modern medicine. Advances in technology, life-sustaining treatments, organ transplantation, genetics, and end-of-life care created ethical situations where clinical benefit conflicted with patient values, individual needs conflicted with population-level justice, life-prolonging interventions conflicted with quality of life. A single ethical theory, whether utilitarian, deontological, or virtue-based, often proved insufficient. Principlism offered a practical, flexible framework capable of addressing real-world clinical dilemmas. Application: balancing principles in clinical decision-making. In practice, principlism functions as a balancing exercise. Consider a treatment decision. A clinician must ask, does this treatment benefit the patient? Beneficence. Does it avoid unnecessary harm? Non-maleficence. Does the patient understand and consent to it? Autonomy. Is it fair and appropriate given resource constraints? Justice. Ethical decision-making becomes a process of moral deliberation, not mechanical rule application. Example: treatment planning under principlism. Imagine a patient who would medically benefit from an aggressive intervention. From a beneficent standpoint, the treatment appears justified. However, the patient refuses the intervention after informed discussion, autonomy. The treatment carries significant risk of suffering, non-maleficence. The intervention is resource-intensive with limited availability, justice. A principlist approach does not simply ask, what is medically best? Instead, it asks, how do these ethical obligations interact in this specific case? The ethically appropriate response may involve honoring refusal, modifying treatment goals, or seeking alternative options. Strengths of principlism. Principlism has several major strengths. First, it reflects the moral complexity of healthcare. Real clinical cases rarely involve only one ethical value. Second, it provides a common ethical language across disciplines, cultures, and belief systems. Clinicians, ethicists, and policymakers can reason together even when they disagree on deeper moral theories. Third, it allows for contextual flexibility. Different principles may carry more weight depending on the situation. Finally, principlism helps prevent ethical absolutism by reminding us that moral goods often conflict. Criticisms and limitations. Despite its widespread use, principlism is not without criticism. Some argue that it lacks a clear method for resolving conflicts between principles. It can become subjective or inconsistent. It may obscure deeper moral reasoning behind pragmatic balancing. Critics also note that balancing principles requires ethical judgment, not simply ethical checklists. Principlism does not eliminate moral disagreement, it structures it. Beneficence reconsidered. Through principlism. Within principlism, beneficence remains essential, but it is no longer dominant or unilateral. It becomes one moral commitment among several, requiring humility from clinicians, dialogue with patients, awareness of social and institutional contexts. Beneficence, in this sense, is guided rather than unchecked. Conclusion. Principlism represents the most influential ethical framework in modern healthcare ethics because it mirrors the reality of clinical life. Ethical decisions are rarely simple, singular, or absolute. By placing beneficence alongside autonomy, nonmaleficence, and justice, principlism encourages clinicians to act not only with compassion, but with balance, restraint, and fairness. Ethical healthcare, from a principlist perspective, is not about choosing one value over all others. It is about holding competing moral commitments in responsible tension. Understanding principlism allows us to see beneficence not as a license to control, but as a moral obligation that must be exercised wisely, respectfully, and justly.